Healthcare providers at Michigan Medicine serve a critical role in the care of transgender patients. Let's look at how healthcare providers across disciplines can provide excellent care to all patients regardless of gender.
So the order says that you're here for a pelvic ultrasound. Is that correct?
Yeah, that's correct. I'm thinking about trying to get pregnant, but my doctor said they couldn't find the string to my IUD.
Okay. All right. Okay, well, I guess we just need to do an ultrasound. I'm just going to put this probe on your belly and we'll see if we can find your IUD. Okay. I'll just have you lay back here. And then if you could sort of lift your shirt up, and then I'm just going to put this on your belly here. I've never done an exam quite like this before.
In the last scene, the person running the ultrasound used body language, intonation, and comments that could easily make a patient feel othered or judged. Small changes in body language, including eye contact and awkwardness with physical exams, send strong signals to patients about whether they are safe and accepted. Let's look at that scenario again with a few subtle changes.
So it looks like the order says that you're here for a pelvic ultrasound. Is that correct?
Yes, I'm thinking about trying to get pregnant, but I need to get my IUD out, and my doctor couldn't find the strings.
Okay. Well, we're going to do an ultrasound today. We'll use a probe on your abdomen to see if we can figure out where your IUD is.
Okay.
Okay. So I'll just have you kick your feet up here and go ahead and lay back for me. And then if you could lift your shirt up a little bit, this might be cold, okay? Okay, a little bit of pressure. All right.
On individual patient encounters, you play a key role in setting the tone in clinic and departments about how gender-affirming care and gender non-conforming patients are discussed. Your work is critical in helping transgender patients feel safe and welcome in our health system. To recap, to ensure we provide excellent care to all people regardless of gender. Avoid assumptions about gendered language. Apologize if you accidentally misgender someone. Call people by the names they request to be called. Reflect this in your charting and update demographic information in MyChart as needed. Recognize the difference between sex assigned at birth and gender identity and document accordingly in MyChart. Questions about one's transition or genitals should only be asked when medically necessary, not simply out of curiosity. Mirror patient language during physical exams. Ensure that your body language and words show that you are non-judgmental and accepting. And speak up if you hear a colleague acting or speaking in a discriminatory or derogatory way. For those interested in learning more about gender-affirming care, resources including the World Professional Association for Transgender Health and the publicly available guidelines for the primary and gender-affirming care of transgender and gender non-binary people on the UCSF Center of Excellence for Transgender Health homepage may be of use.